microphone slightly nearer to you.
Hang on. Can we start live proceedings? I've got a thumb up in the corner. Fantastic. Welcome everybody this afternoon to the Health and Wellbeing Board of the 1st of September 2021. Delighted to see everybody here, and again you can never get away from that joy of being able to meet in the same room together for meetings. It's fantastic. Meteorologically, it's the first day of autumn. Would you believe it? We've had quite I would have said a cloudy, overcast summer. So maybe we can bring some sunshine into your life this afternoon and a little bit of enjoyment. We're going to start off by doing the minutes of the last meeting, and this is for noting. If anybody has something pressing, by all means say it, but it's effectively for noting page 1 to page 8. Page 1, page 2. There's a lot of A's opposite people's names, you might note. The A is not for performance, for absence. Page 4, page 5, page 6, page 7, and page 8. So the minutes of the meeting, are we all in agreement? Approved. Excellent. Can we have apologies for absence, please?
Thank you, Chairman. So the apologies and substitutions I've received are as follows. So Councillor Matt Barney is substituting for Councillor Nigel Turner for this meeting. Hazel Linehan substituting for Fiona Callaghan. Mayor Andy Abrams is substituting for Councillor Marion Bradshaw. I've also received apologies from Lucy Dadge from the CCG, Councillor Sue Shaw from Bassetlaw District Council, and Councillor Abby Brennan from Rushcliffe.
Thank you. Anybody got anything to add to that? No? Yes, sorry, in the corner. Martha, we got that? Come true. Caroline, take a seat. We'll just wait for Idris. Have a seat over there, Idris. Fantastic. Excellent. So we're going to move on to item 3, which is declaration of interest by members and officers. If anybody has got a disclosable pecuniary interest or any private interest, pecuniary or non-pecuniary, please declare it now. No? Excellent. And item 4, the Chair's report, where we concentrate on 1 or 2 items of interest that have occurred over the last period of time. Bryony has excelled herself in that she's come up with 100 different items. She's gone triple digit, Bryony. I'm glad you stopped at 100 items, and I'm sure many of us will have looked through all of those items and examined them in great detail. From our own point of view, and we've got Idris here, he's over there. The top item that's changed really, I suppose, is the integration of Bassetlaw proposed for 2022 into the integrated care service. Those of us familiar with the political boundaries will know that we've provided care anyway, and it's just a case of actually making the ICS boundaries coterminous with the political boundaries. There's been a lot of questions with regards to the basis of it, and it said that it was underpinned by the principles of coterminous boundaries, delivering clear benefits in integration between local authorities and NHS organisations. And of course, the whole basis of the ICS is partnership working, so it makes perfect sense. As an approach to integrated care, it is crucial that we have a system that supports closer working across the NHS and local government. From the point of view of Bassetlaw itself, there is going to be no change to patient pathways. There is no change to how patients access their GPs, and there's no difference to how they will be treated going forward. There are no plans to affect any future developments of Bassetlaw Hospital, and there's no plans to change the planned improvements for the site. The funding remains absolutely as always. Budget allocation and commissioning allocations as before. Bassetlaw Hospital is unaffected, and nobody is likely to see any change on a day-to-day basis. This is based on the coterminosity of the boundaries and is not in any way a cost-cutting exercise. In terms of that, we do have Idris here present, and if there are any further questions, I'm sure Idris Griffiths, as the Chief Officer for NHS Bassetlaw, would be able to elucidate further. Has anybody got any questions with regards to Bassetlaw and its future and coterminosity? Sheila.
I was a little bit concerned, and when I went to see my own GP a fortnight ago, I said, well, what's going to happen if my husband has another heart attack? Has he got to be shipped down to Nottingham rather than Sheffield? He goes, no, he'll still go to the nearest hospital, you know, for heart attacks and whatever. Because it's usually at Northern General they take him.
Idris, would you like to do some clarification on if Sheila's husband has a heart attack?
I hope he doesn't. But yeah, the GP is absolutely right. So somebody who's in acute need will be taken to the nearest hospital that can treat them. And where there's established pathways of care, so individuals who've got conditions that they usually present at a particular hospital. So, for example, Sheffield Teaching Hospital takes quite a few patients from Bassetlaw, provides specialist services. They'll still go to that specialist hospital.
Dr. Jeremy Griffiths.
Thank you, Idris. I'm really keen for a lot of the innovation that comes from Bassetlaw to be highlighted here. I think that anecdotally, I hear good things from Bassetlaw in terms of some of the things that it's doing, challenging some of the or addressing some of the challenges around integration services, and I'd be really keen to hear some of the work that you're doing at some point, and it would be good if there was a forum for
that. Before we go to Idris, Councillor Martin, did you want to ask a question? Go ahead.
Yes, thank you, Chair. Yeah, historically there's been an issue with Bassetlaw Children's Assessment Unit and how children get to Doncaster and Bassetlaw, the Sheffield hospitals, and they've never been brought to Nottinghamshire Hospital before in the past. And the issue has always been about EMAS and Yorkshire Ambulance Service. Is that situation going to change, or are Bassetlaw parents and children still going to have to rely on the bus provision provided by Bassetlaw Hospital, which moves them onto a Doncaster?
So in terms of elective care, nothing changes. So people can choose to go to be referred to a hospital of their choice. For children in need of acute care, you're quite right that they can be treated and supported at Bassetlaw Hospital from an A&E perspective. Currently, if they require an admission overnight, they will be typically transferred to Doncaster Royal Infirmary. It's got quite a large children's unit. For those that have got particular conditions or particularly young or particularly ill, we have the benefit of being able to transfer children to Sheffield Children's Hospital. So yeah, it's one of the few specialist children's hospitals in the country, and can support people with just about any sort of condition. And there's an arrangement for very young children called Embrace that's a very specialist ambulance and transport service, because obviously they typically require care and support during the journey, which goes above and beyond what a paramedic may be able to do in a general ambulance. So there's that facility available as well. For those requiring overnight accommodation at Doncaster Royal Infirmary, we still support a dedicated ambulance service for transferring children between the two sites, and that will continue. Councillor Doddy, in his very good summary, I think, in terms of some of the principles that are being adopted as part of this move, referred to some of the capital investment, and we are expecting and planning, and hopefully it will start this year, a significant capital investment in the hospital at Bassetlaw, and that will actually help support children being able to stay in observation and care for longer periods. So it may be 23 hours a day rather than overnight, but actually we would expect that once that facility is up and running, very, very few children would have to be transferred out of Bassetlaw, and those that would have either an acute illness or need very specialist treatment.
Thank you, Idris. So that's for April 2022, the 116 odd thousand joining the 1.2 million within the current ICS. The other thing that is in item number 10 is vaccinations. When we sat here last, we were absolutely bowled over by the fact that we'd reached 1 million vaccinations in the whole of Nottinghamshire. And I can tell you now it's up to 1.2 million, and we're starting to move down into the 16 to 18-year-olds. We're doing so well that today in the news they were calling for a global end to the pandemic. So that's a statistical factor such that when the pressure of the intensity of the epidemic is uncontrollable, it becomes a pandemic, and then over a period of time back to just a plain simple epidemic, etc. So we're doing remarkably well. One of our big challenges going forward is the flu vaccination campaign, which will be delivered with an enormous intensity this year, reaching more vulnerable groups than ever before. I think it's going to be very successful because people are now used to the concept of getting their COVID vaccinations and seeing the benefit of that. The big question will be whether or not we will have the ability to deliver both COVID and flu at the same time. I think it'll be quite tricky, so most of us are going to plough ahead with the flu campaign, which will probably start next week. We're expecting our flus in next week. The problem with adding in COVID is it has to be a minimum of 6 months since your second vaccination from COVID before we can actually give you a booster COVID vaccination. And also, if you use Pfizer vaccinations, you have to stay an extra 15 minutes in the surgery. If you're doing 1,000 people in a day, you need an enormous amount of space in a doctor's surgery. So we're doing fantastically well with COVID vaccines. We're hopefully going to do fantastically well with flus. And then when the ability and the plan is in place to move towards the boosters, but that is by no means written in stone just yet. Jeremy, have you any update from Rushcliffe?
I think across the system, the plan is definitely at the moment to deliver the flu and the COVID vaccination boosters in a separate manner. There are solutions that are being looked at to try and develop vaccines that will contain both the COVID and the influenza vaccines going forwards, but that's not currently the case. I think it's really worth saying that we still have, I looked at the figures today, there's still 200 people in our NHS hospitals with COVID-related symptoms. That is slowly rising. And we do know that disproportionately there are more young people that are represented within the hospitals, or the unvaccinated. So the messages, whilst we may have a message to say that some of the intensity of the system of the pandemic is reducing, we still have a sizable issue that impacts on the ability to deliver care, and that impacts on the ability for staff to be there in their entirety. There's also an awful lot of changes in health behaviour recently, which are hard to measure, but certainly the report illustrates issues around self-care, so rising levels of usage of alcohol in the population, something we brought to the Health and Wellbeing Board few years ago. And we also are seeing rising demand in general practice. So there's certainly the number of consultations that are taking place within general practice is up about 15% compared to previous years. That may not be face-to-face because of the desire to avoid crowded waiting areas, but the number of consultations has certainly risen considerably, which is putting pressure within the whole system. And I certainly think there is system pressures, certainly in the hospital trust as well at this moment in time. So whilst we've got maybe a change in what we're calling it, the situation actually hasn't changed that much, and it's going to be a challenging winter.
Thank you, Jeremy. Vaccinations, anybody got any questions on vaccinations? Sheila?
I'm being nosy now. Are they going to start doing 12-year-olds, or has it been put off until boosters have been done for elderly, for older people?
I've got no knowledge of 12-year-olds.
I've just heard on news this morning something, that's the reason I'm asking.
I will pass over to the Director of Public Health, Jonathan Gribben.
Yeah, thank you for the question, Councillor Place. So I think we are all awaiting further information from the Joint Committee on Vaccination and Immunisations about vaccinations for healthy 12 to 15-year-olds. So I think we might hear more on that in the next 10 days or so, I would imagine. Thanks.
Thank you. Councillor Wheeler.
Thank you, Chair. Yeah, I can confirm that schools at the moment, obviously I work in a school, so I can confirm that testing arrangements are taking place as I speak. Year 7s are in today in the school I work at. So there's tests taking place this week ahead of schools going back fully next week. And obviously teaching staff and all staff in schools are required to do 2 tests a week, 2 lateral flow tests a week. And if they test positive, then they have to go and do the PCR. So that's the current arrangements at the moment. Thank you.
Thank you. We're going to move on to items 25. Sorry, Councillor Martin.
It's only one for Jonathan, really. Thank you, Chair. I noticed on a sliding scale that 17 to 40-year-olds are right from the youngest age up to the 40-year-olds. It's like a sliding scale of percentage-wise. What are you finding is the most effective method to drive that up? Because obviously you've been using the mobile buses and such like, and I just wondered whether the fixed vaccination centres were working or whether the buses were proving more effective in that area.
Yeah, thank you for the question. So, yeah, we're very concerned in Nottinghamshire County to make sure that everyone has the opportunity to take up the offer of vaccination. So for younger age groups in particular, we found over recent months that it's the convenience factor which is really key. And when we've made it as easy as possible for people, that's when we tended to get higher uptake. And so for some, well, probably months now, not weeks, our local NHS colleagues have been making sure that in vaccination centres, there's the facility for people to walk in without appointment and to get jabbed. And that's been very successful. We're particularly concerned to make sure that we keep going with that and that all of our residents know that the offer of vaccination is, as my NHS colleagues say, an evergreen offer. So even those people who may previously have hesitated and decided time's not right for me yet, they don't run out of time and they will still be able to get vaccinated. And we're pleased to say that there are still people coming forward. And of course, in vaccination centres, there are healthcare professionals there available. So that if people have got specific questions they want to talk through, there are people there who can talk them through the evidence so that people are in a position to make a really informed choice.
Thank you. We'll move on to a couple of more items within the 100 items. We'll move on to point number 25 through to point number 30, and this is about substance misuse intervention and the fact that we've got increased money awarded of £810,472 over a 12-month period to look at drug and alcohol misuse. Nobody can fail to have actually seen the enormous increase in alcohol abuse over COVID and lockdown, and Jeremy rightly mentioned that we had a liver specialist here a couple of years ago talking about liver interventions and how liver disease was probably one of the biggest killers of middle-aged men in the UK with cirrhosis, etc. So the amount of liver disease, the amount of cirrhosis and deaths directly attributable to alcohol is at a record high. You can equally well look across at deaths from drug abuse, deaths from ingestion of substances, cocaine use up 10%, and the deaths from drug abuse are at record highs. So if there was rewards for the most deaths from drug abuse and alcohol abuse, we'd get a gold medal. It's a fantastically interesting area, and I think we're delighted that we have got Caroline Henry, Police and Crime here, because Dame Carol Black's independent review suggested that we should have a whole system approach to managing addiction, managing drug abuse, managing alcoholism, to treat it like a chronic condition, treat it like you would do chronic lung disease, treat it like you would do diabetes, have clinics, have follow-up, have long-term life course approach to managing the problem, which I think we'll probably hear more about in a little while. So that's the possibilities going forward, and there's a joint responsibility which we'll hear between the County Council and shared work across that with the police and crime. There have been some successful interventions nationally with minimum unit alcohol pricing in Scotland, reducing consumption by 7.8% amongst the biggest drinkers, the biggest volume purchasers of cheap, strong, readily available alcohol, soon to be followed by Northern Ireland. Wales have already begun it and seen similar reductions in alcohol. So we need to look locally, we need to look nationally as well. Jonathan, do you have anything you'd like to add to the epidemic of drug and alcohol deaths?
Just two things really quickly, and that's to note that this is another agenda clearly where there's a whole partnership contribution to make, not only with your office, Caroline, but of course with NHS colleagues as well. So the Nottingham and Nottinghamshire ICS has a health inequality strategy, and the work on alcohol in particular forms a really important part of that. So I'm working closely with my colleagues in the local NHS to make sure that we pick up some of that as we all come out of recovery, and pay some attention really again to how we can close some of these inequalities and have a real impact on them. And I'm really pleased that you mentioned there, Chair, the experience that is now emerging from Scotland around the positive impact that minimum unit pricing of alcohol can have on those communities where the burden of alcohol misuse falls most heavily, and that's something that I'd be really pleased to bring back for discussion, maybe at the Health and Wellbeing Board at a later date.
No doubt it will be a big part of the health and wellbeing strategy going forward. Anybody else like to comment at this moment in time? No, Sheila? Yes, Sheila?
I mentioned to Jonathan the other day about how many drug users we all see. Nearly every street corner you see somebody drop something off in a little tiny packet, and you see little packets all left in a where a group have been and used things. But even walking through woods, I can smell cannabis being grown, you know, and I'm thinking, well, where are they growing it in here? I've been even looking in amongst woods to try and find it. It's everywhere, isn't it? We can't get away from it, and we've got Walking Dead on streets, haven't we? When they've lost all the weight and
yes,
it's horrible.
Don't mention the name of those woods, Sheila. No. In terms of drug and alcohol, it's going to be a big part going forward, and it'll be something we come back to again and again, and it'll form a big part of the strategy both for us and for police and crime. Another area just before we leave is the food environment, which is something very close to my heart, as we've seen an enormous increase in the problems of diet over lockdown. We've seen phenomenal increases in the number of diabetics. Every single day I'm diagnosing somebody new with diabetes, and yet in the whole of that we also see malnutrition of sorts. We see populations with vitamin D levels in the boots. We're seeing cases of high calorie intake but poor nutrition. We have a lot of things going on at County Hall. I particularly worked with John Wilcox in 2019 trying to turn Nottingham into a food charter shire, one of the first in the country. And we're going to revisit that. We've got childhood obesity clubs, and we started back then again the Trailblazer Club for food clubs, and childhood nutrition is obviously huge, with something like 8% of 7-year-olds being overweight and 15% of 12 to 13-year-olds and 70+% of them going on to be obese adults. The challenge of nutrition is one of the greatest single challenges that we're going to face going forward in how to keep the population healthy. We can't necessarily extend healthy life expectancy, but we are expected to intervene in a way, but the nature of our lifestyles dictates that we're actually getting iller sooner and living longer in ill health, and that's one of the great challenges that we will have through health strategy. Anybody got any questions with regards to that? We've seen in the papers just at the weekend how salt contributes to 50% more heart attacks and strokes, so salt-free diets, etc. Councillor Walters.
So thank you, Chair. Could I just spin you back to paragraph 33? It's pleasing to read that deaths from drug misuse in Nottinghamshire is doing quite a lot better than our neighbours. But could you clarify, what is CIPFA? I know is Chartered Institute for Public Finance Accountancy. What?
Jonathan.
So, Councillor, yes, thank you for the question, and you're absolutely right. The acronym stands for exactly that, and it's through CIPFA that we are able to identify some of the other local authorities that are most similar to Nottinghamshire County, and that's where I think the comparison is being made.
Thank you. We shall come back to food strategy, the government having published Plan A and Plan B. And it'll form a big part of our strategy going forward. We're going to move on then from the top 100 to item number 5, which is the stakeholder engagement for police and crime. Today we've got a number of stakeholder engagements suggesting that we're starting out on a path over the next 4 years, and this will not be the finished items. This is laying out the strategy by which we're going to come up with the plan that we will hopefully deliver. We're delighted to welcome Caroline Henry after her recent success in the police and crime, the police crime commissioner elections. The Police and Crime Department do have a statutory obligation to come forward with a police and crime plan, and they have shared responsibilities across drugs, alcohol, domestic abuse and violence with us here at the Health and Wellbeing Board. So over to you, Caroline.
Thank you very much, Chairman, and thank you, colleagues, for inviting me here today. Delighted that I got elected in May to be the Police and Crime Commissioner for the best county in the country, my home county, and it's really important to me that I deliver as your Police and Crime Commissioner. It's essential that we do the partnership work, and I want to be known as a listening commissioner that works with partners. So before I do my police and crime plan, I want to listen to what is helpful for you to have in my police and crime plan, and I have a statutory duty to do the public engagement piece. Taking this really seriously, I've already started having events across the county. I think my first event was in Bassetlaw, and to make it as visible as possible, as well as doing the event in person. I'm also using technology to live stream, because we do know that sometimes people aren't comfortable about coming out to events at the moment. And I've got a series of these events happening. Bassett Law was the 12th of August, Ashfield the 14th of September. I'm in the City on the 16th of September, Rushcliffe the 29th of September, Newark the 30th of September, Gedling 7th of October, Broxtowe the 13th of October, and Mansfield on the 14th. I'm also doing thematic events. I've already done a violence against women and girls event. That was a virtual event, because this is the topic that's really close to my heart, and I know it's an agenda that we share. My plan will be, I have a police and crime panel next week, but I need to engage first. I can't write the plan until I've listened to what people need. So I have some emerging priorities, but I see just talking about the emerging priorities next week and then presenting my draft plan to the police and crime panel in November. Those emerging priorities seem to be along three themes. The first, which I'm really passionate about, and I know it's a passion that you share, is the preventative work. So it's about preventing, responding, and supporting. But the work we do in this room together is very much, I think a key part of it is the preventing. We know all our budgets are going to be really squeezed. And financially, it really makes sense to prevent, from my point of view, crimes happening in the first place. If I give an example of how that can happen, by funding a vulnerable youth worker who's actually worked in the City, financially, I know that saved the force £1.2 million, because we put a price on how much it costs us to investigate a missing person, and the work that this particular guy has done has saved £1.2 million worth of work. But I'm not all about the money, but actually that's also saved those vulnerable people going missing. So we know we need to use the public health approach, we need to do the preventative work, and we need to work together. The chair's already alluded to areas of shared concern. Substance misuse. I know, having been, it's going to sound wrong if I say I've been down to our custody suite too often, but you know what I mean. How many of those people going into custody have either alcohol or drugs in their system? It's the majority, and not just the ones that go in there. The crimes that people get, that it causes, and the misery because of that. We absolutely have to get tough but also supportive of getting people out of these addictions. It's a major driver for crime, poor health outcomes, and we do jointly commission drug and alcohol services across the county. Domestic abuse and sexual violence, again, we jointly commission services, and we know we're only touching the tip of the iceberg, and we know there's more to do here. I was delighted that I was actually able to secure £1.8 million, so I could put ISVAs. These are people who support domestic abuse victims going through the system, and ISVAs for sexual violence. Massive backlog in the courts. It's a real issue, and I'm working on that end too. But more to do, and we need to do more joint work together there. And with regard to serious violence, preventing it, I'm really proud of the work that's happening with Nottingham Violence Reduction Unit. But I'll be frank, too much of it has been concentrated in the city centre. I know we've got huge issues there, and I'm not denying that. And I'm not looking to take work out of the city centre, but what I want to do is make sure we have more funding so we can spread that work across the county. We know where the hotspots are. We're all dealing with the same people. So I've actually got some more funding for the Violence Reduction Unit. I can't remember the figure, so I'll quote them. £600,000 from the Home Office investment to city and youth custody provision. We're anticipating, and this bid is looking really good at the moment, for some youth justice-led custody provision, and that's hopefully over 3 years. And one of the things I'm most excited about is launching a youth work programme. Now it's going to be record breaking. We're the first ones to be doing it. It's with the National Youth Agency. It's been led by a youth charter, which was co-produced with young people from the city and county. And it aims to drive up the quality of youth work in the voluntary and in the community sector. So we'll be launching it later on in October. Absolutely recognise that. I just want to reiterate, further engagement is needed from our office with young people, and particularly in the north of the county. And we're actually got plans in hand to be looking at doing that. So 3 main themes: preventing, responding and supporting. There's joined up work we can do on all of that. And if questions, if there's time for questions, Chair, I'm happy to take any.
Thanks very much, Caroline. You clearly bring a whole new energy and vision, reinvigorating the role of the Police and Crime Commissioner. And it'll be very interesting to see how it progresses over the next number of years. It is obvious that all of these cross boundaries, the alcoholic is not just damaging himself, he's probably associated with some domestic violence, he could get into problems with the police, he could get into fights, he could end up in the casualty department, he could end up on the wards with liver cirrhosis.
Yeah.
So it expands over a huge number of different areas. I'm glad to see that you saved that 1.2 million. I think myself and Jonathan are going to go and ask if we can have some of that money for the public health department. You keep saving the money, Caroline. Yes. So prevention, responding and supporting sounds like a very good mantra. Has anybody got any questions for Police and Crime Commissioner? Councillor Wheeler.
I actually work with young people, so I'm pleased to hear that there's going to be commitment towards the violence reduction unit. I actually work with young people in the Arnold area in Gedling, so I'm Gedling District Councillor, and I know a number of youth workers who are on temporary contracts at the moment that have done quite a bit of work locally in the local community, engaging with young people to try and tackle issues around county lines and so forth. What sort of commitments can you give in terms of looking at the permanency of youth intervention work locally to tackle some of those key issues on the ground around preventing young people actually becoming part of the criminal justice system, particularly around tackling some of the issues around county lines, for example? It's one of the things that's really quite worrying at the moment, because obviously over the pandemic, a lot of our very vulnerable young people have got a few of them have slipped through the net somewhat and have been groomed by some of these slightly older, younger people into, doing the counterline stuff to the point where, without actually mentioning any names, I know one young chap was actually found in Oxfordshire, shipped out from Nottinghamshire to Oxfordshire. So I'd like to see some really positive work on the ground to tackle some of those issues across the county. But I'm quite interested to see what would happen in Gedling in terms of looking at some more permanency rather than, some of those jobs being sort of on a contractual basis where they're up for grabs every sort of 6 or 12 months. Thank you.
Thank you very much for that really interesting question, Councillor Wheeler. It is incredibly frustrating how short-term the funding is for a lot of these projects. A lot of the work I'm bidding for, we have a really short time to put the bid in. We then have a really short time to spend the money, and there's no sustainability. It's actually very difficult to even recruit people on that short-term contract, quality people who want the work. Wherever I can, I am really pushing for a three-year funding. But I'm afraid I'm not getting as many answers as I'd like that say yes on the 3-year funding. Just managing expectations. The wheel of funding at the moment seems to be that we have to bid for projects and we get short-term funding. I've just got to manage expectations. That is the reality of how the government are funding projects at the moment. Sorry.
Did you want to come back, Henry?
Voluntary sector. I know of 1 or 2 voluntary youth organised. So, for example, the Python Club, they've worked quite a lot in the city, but they've also done some youth engagement work within Gedlin. I think they've done a little bit in Broxtowe. So it'd be quite interesting to see how you can engage with some of the more, the voluntary sector to try and fill some of those gaps that aren't being filled moving forward. Thank you.
I would really welcome further conversations. The voluntary sector is so important to us, but we know that actually the county line stuff is massive. Apparently it's called going OT now, going out of town. I'm trying to get the lingo right, and also the cuckooing is now known as trap housing. It's evolving really quickly, and it's a massive issue. We are looking at it.
Thank you, Caroline. Anybody else got any? Jonathan and Sheila. OT will always be occupational therapist.
If you could get yourself into bother there, Chair. You really could.
If you go out to town with an occupational therapist.
Yeah.
Yes, Jonathan.
Thank you, Chair. Not so much a question, but if I might, just a couple of comments. So thank you for framing this so clearly in terms of prevention, and that straight away, I think makes the link between what you're setting out to do, what the Health and Wellbeing Board more generally needs to be looking at, and indeed I think what Derek Higton will be talking to us about in terms of the county council's plan as well, because a lot of this needs to end up being around the places in which we live, making sure that they are healthy and sustainable. So attending to jobs and housing and environment, safe environment, amongst other things. The custody suite that you mentioned, and what you observe there, of course, is also the tip of the iceberg. And what you see there, it actually represents an enormous burden of need across our residents more generally, who don't find themselves in custody suite, but whom we also need to attend to. On domestic violence, the domestic abuse bill, of course, that came in is an enormous opportunity for us across the country and in Nottinghamshire as well. And I'm really pleased that with that has arrived some additional funding. And really looking forward to working with your office and with other partners around strengthening arrangements for survivors of domestic abuse, but also turning our attention to what we can do to prevent that increasingly in the future. So thank you for your comments and looking forward to working with you.
Thank you, Jonathan. I'm going to take one further question from Councillor Martin, and then we'll move on. Councillor Martin.
Yeah, thank you, Chair. I'm glad to hear you talking about engagement, because obviously engaging with the youth from 15 plus is the biggest issue, because they leave the county councils, youth clubs and setups at that age, and that's when they become a problem. So but historically, what happened around 2015 when the police numbers went down to around 1,670, something like that, from previously in 2010 from around 3,000. And that diminishment in numbers, and then the change in the police forces, perception of cybercrime and drugs and terrorism, all that has taken away the resources. So I'm particularly happy to hear you mention about the city, because it has been one-sided, because in the more rural areas, where those other pressures, those other external pressures have created a void, and there's been a lack of police presence, and that's allowed antisocial behaviour to escalate on a massive scale. And I remember going out with my CPOs in my area in Jacksdale, and we went to a property and we sat outside, which we knew was a drug collection point, and we took the registrations of the vehicles, and they came from Sheffield, Chesterfield, Pinxton, Hena, and they were in Jacksdale because there's a very low presence of police in that area, and that's one of the issues that exacerbates drug crime in the more rural areas. And you know where the hotspots are because those crimes get reported. I can think of 2 particular areas in Ashfield that were concentrated on in 2016, and the impact of that was that the rurality was left with carefree abandon, and that's where the hotbeds come. And we are actually linked very well by major national infrastructure, the M1, A38, you know, to name a couple. So that those particular areas, visual presence would help to combat some of that antisocial behaviour, because that's what we really suffer from, and that's what makes our elderly residents feel that they can't go out at night. Thank you, Chair.
Thank you, Councillor Martin. Are you happy with that, Caroline, or do you want to say anything?
I absolutely hear what you're saying, which is, but again, I've put a bid in for Ashfield to try and get some extra money. I'm not sure if I'm going to get it or not. It was my primary bid. My primary bid was for workshop because the need there was greater for this particular bid. But I could, if that bid happens, it will environmentally it will help create a more welcoming space where we know we'll have less crime, we'll have more ANPR, automatic number plate recognition, so people don't come down off out the area into it. More CCTV. There's things we can do, but I've got to get the money to do these things, and money is incredibly tight. So, but also, if people see stuff, I really want to encourage people to report it, because we need to build our confidence in our rural communities to report the crime, because then we can justify the need to have more officers there if we've got more crimes reported. So that's, and I know it's not quite on message today for what we're talking about, but it is really important. Please report crimes if you see anything. Thank you.
Thank you, Caroline. So we're going to move to recommendation that the Health and Wellbeing Board receive the presentation on the proposals for the new police and crime plan and provide comment and consideration to help to inform the objectives for Nottinghamshire for 2021-2025. I'll move to recommendation. Jeremy, can you second that? Thank you. Seconded. All those in favour? Excellent. So thank you very much, Caroline, new Police and Crime Commissioner, and hopefully we'll see you here on a regular basis at the Health and Wellbeing Board. Thank you. So we're going to move on to item number 6. Item number 6 is the stakeholder engagement for Nottinghamshire County for the plan 2021-2025. It's a common theme where we're starting to outline how we're going to involve the stakeholders in order to develop the plan to improve Nottinghamshire, particularly with regards to the long-term plan and, just as importantly, COVID recovery plan. So we're going to pass over to Service Director Derek Higton. Thank you, Derek.
Thank you, Chairman, and good afternoon, everybody. Thanks for having me at the Health and Wellbeing Board this afternoon. You've got a copy of the report that we've pulled together for you, but largely what I'm going to do this afternoon is just walk you through a few slides that outline what we're trying to do in the development of the council plan, as the Chairman says, for 2021 to 2025. The purpose of my input this afternoon is twofold, really, to draw your attention as representatives of a whole range of organisations across the county to the public partner engagement process that we're partway through at the moment. And secondly, to tell you a little bit more about the genesis, the purpose and the intention of the council plan as well. And hopefully we can bring both of those two things together in a bit of a discussion at the end, so that you can both offer an individual and organisational perspective on the council plan, but also we can think about whether the plan is pressing the right buttons from a health and wellbeing perspective as we go through that process of development. So we've got, as I say, a few slides, and hopefully my vision will hold out long enough to be able to read them and navigate them through for you. So we're developing a new council plan for 21 to 25, and what that does really in the context of our experience over the last 18 months with COVID. It provides us with a chance to kind of reset the long-term vision for the council within the context of COVID recovery. So our internal conversation within the county council is that our council plan will in effect be the council's COVID recovery plan. And we absolutely recognise that recovery from COVID in terms of all of the impacts as it's had over the last 18 months and will have going forward is not something that can quickly be delivered or something that can simply be delivered. But within the context of a 10-year vision and then a 4-year delivery plan, we've got the opportunity to set out the things that we're going to do first of all, not just as a council, but of course as a council with a significant partnership heritage and partnership approach as well. So the plan will also set out how we're going to organise ourselves as a council to ensure that we're effective, efficient, deliver value for money and so on into the medium term future. But to underpin all of that, we're doing quite a bit of work at the moment to ensure that we properly understand from the perspective of residents the kind of socio-economic impact of COVID. And as part of our work around that, as well as doing some research into how things are looking from a kind of evidence perspective, we're also gaining the perspectives of our residents. So we're bluntly asking all of our residents some simple questions about what their experience of COVID has been like as individuals, as families, as communities, and what they think the challenges and the opportunities that come out of COVID are for them, their families, and their communities as well. That will help us understand better how COVID has impacted upon the lives of people in Nottinghamshire over the last 18 months. And it will also give our residents the opportunity to express to us what their aspirations are, what they see as success, what they want to see from the council, what they want to see as a resident in Nottinghamshire, and what they want their life to be like over the next 5 to 10 years. And we're going to take all of that work and then feed that into our development around a development of the plan itself. Thanks, Bernie. So hopefully, if you live in the county, you'll already be aware of all of this. We've put quite a bit of effort into publicising our public engagement process, and you'll see in the report, but also on screen as well, that there's an opportunity on the council's website to take part in what we're calling the Big Knots survey. We've done a mail shot to every home in the county, all 320,000, and we're already getting thousands of responses back from our residents telling us what life's been like for them and what they'll want life to be like for them, for themselves and their communities in the future. So it's a really significant piece of public engagement, probably the most significant we've ever done as a council. And it's certainly the biggest response we've had thus far as a council. We're about 3 weeks into the process, so we've got well over 7,000 responses already, and so we're really feeling what local people are thinking about life in the county. So in terms of feeding all of that into, as I say, the long-term vision that we're starting to develop for the council, and I think this is where these issues become of particular interest and significance to the Health and Wellbeing Board. We've started to develop that long-term vision. The council has tended in the past to have a much shorter term set of ambitions that have coincided with the electoral cycle. That the council's new administration wants to set a much longer term vision, partly in recognition of the fact that the kind of societal changes and economic changes in improvements that we're wanting to support and drive as a council often take a significant amount of time to come to fruition. Things move a little bit more slowly than perhaps we might want them to. So that long-term vision is there to provide a kind of stable strategic platform, if you like, for all of the good things that we want to achieve. And so what we're absolutely wanting to focus on is a recognition that for, as it says on the slide, for our communities to be strong and sustainable, we must ensure that the people that live in Nottinghamshire, as far as possible, enjoy good health, live in a supportive place, have got good jobs, are well skilled, and as far as possible are prosperous and are supported by a prosperous local economy that supports a good standard of living for all. And critically, and particularly timely these days, we've got to ensure that all of that happens in a place that's environmentally sustainable and makes best use and appropriate use of the natural resources available for us and safeguards them for future generations. The shorthand that we're using there is a kind of sustainable communities approach. And ultimately, given the size of the county, the population of Nottinghamshire, 830 odd thousand people, we want to ensure that we leave no one behind. Thanks, Bernie. So we've tried to capture it, and here's where I'm going to rely on what I've got in front of me rather than what's on the slide. So if you're part of the hybrid working arrangement, you're probably benefiting from that now. What we've set out is a bit of a graphic that outlines what that long-term vision is for Nottinghamshire. In the middle of the dark green box there, what we're describing as our kind of ideal state is a healthy, prosperous and greener Nottinghamshire for everyone. That's something that we think our communities and our partners can hopefully get behind. And we're breaking that down further into 3 elements of that long-term vision: healthy and thriving people and communities, a prosperous and growing Nottinghamshire economy, and a greener Nottinghamshire future. That emphasis on sustainability, the environment and the green agenda is new for this council. It's not something that's been highlighted previously as an absolute core priority for the council. And I think from our perspective as officers, it's really welcome that is now seen as an absolutely key priority for the council, because of course it reflects in many ways what the public perceive to be critical for the future of not just the county, but the wider world as well. And within that, or around that, we've set a range of individual outcomes that we're seeking to achieve and deliver over the next few years. Many of them coincide directly with the work and the focus of the Health and Wellbeing Board, and touch upon a number of the issues that have already been discussed this afternoon as well. But we're clearly making and continuing to see the fact that keeping people healthy, ensuring that people live independent lives for longer, are absolutely at the heart of what we do. Resilient communities, resilient families, and effective support for vulnerable children, adults and vulnerable communities as well. But just 3 of the things on the left-hand side of that graphic there that we're wanting to prioritise. So I've run through very quickly what we're wanting to do around the council plan and how we're describing our current progress towards vision and delivering a whole range of outcomes. I've touched a little bit on as well the consultation and the engagement process. There will be a partner engagement process as well that will kick off from tomorrow. So all of our partner organisations will also have a chance to contribute organisationally to and comment upon the developing council plan and to ensure that we receive and hear your views from an organisational perspective on the work that we're doing to develop that Nottinghamshire plan. But we thought it would be really helpful this afternoon to offer colleagues on the Health and Wellbeing Board the opportunity to discuss that kind of broad brushstroke approach that I've outlined in the previous slides this afternoon. And we've put up there a few prompts that we think might help shape that discussion. So is there a reasonable fit from the board's perspective with your current aims and objectives? Are there things from the board's perspective that you think it will be helpful for the council to really prioritise and focus on over the next few years? And it will be interesting from my perspective to hear colleagues and partners' views on the kind of level of engagement that you'd like to see from the board's perspective with the council plan as it develops and changes and iterates over the coming few years. So that's it, Chairman, from me. I'm happy for the discussion to go wherever it now goes.
Thank you, Derek. Certainly wide-ranging and ambitious, and fits in perfectly with the statutory obligation of the Health and Wellbeing Board to extend healthy life expectancy and life expectancy through addressing all the things that are around us that actually make us healthy: our work, our houses, our friends, the things to build the resilience to deal with the common mental health problems, etc. So very wide-ranging and very ambitious. Dr. Griffiths.
Thank you very much for this. I think it's a really big opportunity. Just trying to draw from some of the other things that we've talked about today and how this links with the vision for the council. There's no doubt that without what COVID's taught us as we've gone through what effectively is a disaster. Maybe it's not as visual as things like a tsunami and hurricane, but it is actually, we have gone through a disaster, and the responses that we're actually seeing from the population mirror those of what we see in disasters. And there's no doubt that what that's taught us is that you cannot have a thriving society without good public health. And we've listened today about in the chairman's report about the increased use of drugs such as alcohol and other drugs as well in our population. We've heard from the police commissioner about the desire to put prevention at the forefront. And I would just put a little bit of challenge into particularly the vision in slide 7, which is where you've said people are healthier and live independent lives for longer. And then you've also said people have education and skills they need to get good local jobs. And I would put it to you that actually we're at the point now where one of the strategic aims should be to ensure that people have enough education and skills to be able to make good health decisions and healthier life choices that ultimately will impact on a lot of those things. And whether that's the role, whether that's looking at the role of our schools in educating individuals around life choices, our universities are absolutely rife with drugs. That's anecdotal, but actually statistical as well. That these are becoming culturally normal, and we have to put some challenge back to that. That these are not normal behaviours. These are behaviours that ultimately are destructive. They're destructive for individuals and they're destructive for society. And I'm not sure of the exact wording, but in terms of the ethos and the principle, I think there is something there that is missing, and I would urge you to look at that.
Thank you, Dr. Griffiths. It could be argued that life itself is a destructive thing. Any other questions for Derek? At the back.
Hi, Sarah Collis, Health Watch, Nottingham and Nottinghamshire. My label's over there. So yeah, my question alludes to what you've just said, Jeremy, about the disaster that I think we've all experienced. And unfortunately, what tends to happen in disasters is that some people suffer a lot more than others. And I think this has absolutely been borne out within the pandemic across the county, that marginalised communities are particularly hard hit. When we're looking at engaging on the plan, I'm intrigued and interested to know how we're going to actually reach those communities. I know you mentioned that there's been a mail shot to every household, which is great, but we know not everybody will respond to that. Brilliant. It sounds like it looked really good response so far, but I'd really like to know how we're going to hear the views of communities that have been hit the hardest, and often are the least likely to engage, because I think that's where we'll start to really see the nuance of what people need, what their experience has been, and what they need to be different going forward. Thank you.
Derek, would you like to respond?
Thank you for that question. So I think it's a really good question. We've actually, as well as our kind of public survey, we're engaging with different parts of our communities in a number of different ways. So we're doing about 1,000 face-to-face interviews across the county that will hit all of the various demographics that we've got in Nottinghamshire to ensure that our response is kind of statistically valid. But through a number of our council services, we're also reaching out to a range of service users, clients, customers who perhaps might not, under normal circumstances, get to complete that online survey, either for reasons of choice, not being aware of it, or it not being accessible to them. So we're doing quite a bit of work to ensure that we can publicise our engagement work and publicise the survey in ways that are accessible to different communities. We're also doing a number of kind of focus groups with a range of groups and communities around the county. We're also engaging through our elected member networks as well, our voluntary and community sector networks, and through our town and parish council networks as well. That said, there always will be one or two bases that we haven't thought of, that bases that we haven't hit. If you think it would be helpful for us to have a conversation around particular groups that you might be able to help us facilitate a kind of conversation with, I'll be really happy to have that discussion with you.
Councillor Tideswell.
Yeah, thank you, Chair. At the moment, I've lost the plot because I'm not actually aware of where we are with what part of the minutes, because I've had problems following the speech. So I'm presuming we're on, is it page 9 and forward?
Thank you. We're on item agenda number 6, stakeholder engagement and Nottinghamshire County Council Plan 2021-2025 by Derek Higton.
So we've already gone through that. All right.
We're asking questions on it now.
To speak on that. I didn't realise we'd actually gone through that.
No problem. We can come back to you.
He said we can come back to that.
Or the stakeholder engagement.
Correct. Yeah. But the stakeholder engagement for police and crime, stakeholder engagement for the county council, and in a few minutes.
Sorry, can you repeat that, please?
Stakeholder engagement for police and crime, which we've done. Stakeholder engagement for Nottinghamshire County Council.
I didn't realise we'd actually gone through that because I'm having difficulty in hearing certain voices.
I would be delighted if you want to come down and sit beside me here. It'd be.
Well, the problem is that would be my desk side.
Okay. What about over this side?
I will try it.
Give it a bash. Yeah. Thank you, Councillor Tideswell. Okay, Councillor Walters.
Yeah, real quickie, I hope. Will the results and analysis of the survey be made public, or if not to the general public, will we get to hear it at the board and maybe also the district councils?
Thank you. Another really good question. The short answer is yes. We'll be publishing obviously a summary version of the feedback through our committee reports, which are public, but we'll also ensure that the feedback that we receive forms a component of the actual published council plan, and our district and borough council partners are already helping with that public engagement, and will definitely ensure that we feed back the kind of district level results to partners as well.
Thank you.
Thank you. I'm going to move the recommendation that the Health and Wellbeing Board members receive the presentation and the proposal for the new council plan, provide comment and consideration and inform the vision and priorities for Nottinghamshire 2021-2025. Move the motion. Can we have a seconder? All those in favour? Excellent. So we're going to move on to item number 7. I'm just going to wait for Councillor Tideswell and then we can synchronise. Item number 7.
Item number 7.
7. Yes, this is going to be a refresh on the health and wellbeing strategy. This is the big one. Page 33. Thank you. Item number 7 is the refresh of the joint health and wellbeing strategy. This is a statutory obligation on the Health and Wellbeing Board, and those of you who've been around in the past will have seen 2 strategies following the introduction of Health and Wellbeing Boards in 2012. We had the first strategy, which actually went 2014 to 2017, and for a visual imagery, this is exactly what it looked like, a simple strategy. Councillor Bosniak, if I remember correctly, was chair at that stage. And then we've moved on to the second one, which was 2018-2022. It's remarkably similar. It's even got the same people on the bottom, and they look as well as they did the first time round. So it can only be that the health and wellbeing strategy is alive and well and working very well. So the officer who's leading on the health and wellbeing strategy is Sue Foley, and I'm delighted to introduce Sue and ask her to lead on the up and coming strategy and our plans. Thank you, Sue.
Thank you, Chair. Hope everyone can hear me. Okay, looking good. Okay. So yes, we've all got the paper. At the moment, it's quite high level. It's mainly around the process of how we're going to refresh the strategy. As the Chair has alluded, the importance of the strategy has only increased since we've had COVID, and health inequalities have that were there in the beginning have only exacerbated as we've gone through COVID, and the wider determinants that impinge on health have only been highlighted by COVID as well. So, and also has been alluded around the council plan is around the impact of climate change on all of that as well. So the strategy, as Chair said, has had 2 previous incantations, but the current one, I think, is a real opportunity to really make a difference around those health inequalities. So there is going to be a little review of the 2018 to 2022 strategy, just to see how that went in the document that we're going to produce. So there is going to be a short survey that's going to go around to members and officers, just to say how did it go with the previous strategy? How did the subgroups go? Were they effective? What particular aspects of COVID were detrimental to the delivery of the strategy? What actually was beneficial to the delivery of the strategy? And also just to highlight the changes that have happened with regard to the integrated care system coming on board, the changes to the council and the county during those 4 years that strategy was in place. There's going to be a little review, so please look out for the survey, and please just give as much feedback as you can, recognising that quite a few of you weren't actually members of the board, but even if you just respond as a member of the public from Nottinghamshire, that would be really useful. So there is going to be an evidence summary. My team, the Public Health Intelligence team, working with partners in within the ICS and council as well, is bringing together some of the evidence around what are the main health burdens, health and wellbeing burdens there are at the moment in Nottinghamshire, bring in some of those COVID impacts as well to come up with some priorities and themes for suggestion for the strategy. Also, as the paper alludes to, partnership working in this is going to be extremely important, and also how these strategies are going to link up as well, because we've heard about the strategy that the Police and Crime Commissioner is going to produce. There is the council plan as well. As Chair has said, there is the health inequality strategy that the ICS have produced as well. So it's making sure that all these strategies actually work together and don't start either duplicating or fighting against each other, and they actually all work together to achieve the outcomes that we want. So that's an important part of how this strategy is going to go. As usual with timescales, things are quite tight in producing this strategy, and the main first deadline is the workshop that's going to happen on the 13th of October. It is for members to please attend in person if you can. If you can't, please send a deputy, because this is the real opportunity for the first iteration of the paper to come to board, and where we'll have a discussion and workshop around the themes and priorities that come out of the evidence summary, and then board can decide what the direction of travel is for after that workshop. So that's the first real opportunity to influence the strategy going forward. So please, the invite for that is I think it has gone out already, I think, as a hold, or at least an invite. So please attend that face to face if you can. I shall be travelling up from sunny Berkshire to help facilitate that meeting with my 2IC Bryony Jones, who's there at the meeting at the moment. After that, of course, will be the consultation. We won't be sending out a polished version. It will be a version that we really want feedback on from all the parties involved. There will be a mixed approach, because it has been alluded to that the public and partners will have an awful lot of surveys and consultations to be going on with, and also people may not wish to attend in person. Previously, road shows have been done, but we're thinking about a mixed approach, road shows, but also online as well, and of course using other surveys as well, such as Derek has said about the Big Not survey, because obviously there are a lot of questions around health that would be really beneficial to the strategy for the Health and Wellbeing Board. And please inform Bryony if there are any key events or meetings that are happening that we can present the Health and Wellbeing strategy at, so we can inform partners and involve people as much as possible. So please inform Bryony of any meetings or key events that there are. And then the final version will be presented in the new year to the board. So that, in a nutshell, is the process that's going to be gone through. But just to keep in mind that the first big event is that workshop on October the 13th, where as board members, people can really influence and just give feedback as to what the themes and priorities should be for the strategy. And I think the other main thing is around the partnership working and the other strategies and plans that are involved, to make sure that it really complements those as well going forward. So thank you, Chair. That was it from me.
Yes, thank you very much indeed, Sue. I think we've got a monumental challenge to improve healthy life expectancy and life expectancy. Life expectancy was plateauing anyway due to a variety of circumstances, and with COVID it's actually declined. So we'd probably have to turn that around. And healthy life expectancy, people get ill probably 15 years before they're expected death, so they get ill even before they retire, so they're ill through retirement and then they die. Quite a challenge. Jonathan, would you like to add to the health and wellbeing strategy?
I was going to mention one thing that you've just touched on there, which as other people have noted, when we're talking about recovery from COVID, it's tempting at times to think in terms of getting back to normal, getting back to where we were. And of course, the opportunity for us coming out of COVID is not to get back to where we were before, with the state of inequalities within Nottinghamshire as it has been, but actually to do something that goes above and beyond and more. And I think that's the opportunity for us with this strategy, and indeed with the other strategies that we've been hearing about this afternoon. There's one challenge I'm sensing, which I would really value advice and input on over the coming weeks and months. Clearly, the work of the Joint and Health and Wellbeing Strategy will be delivered by partner organisations, sometimes working closely together in really close collaboration, sometimes just getting on with it back at our bases. I think one of the things which we haven't got quite right in the strategy that we have at the moment is the monitoring and evaluation bit. Now, we do not wish to create a whole industry out of counting and monitoring and so on. But I really would like some good strong steer and advice from district and borough colleagues in particular, and others too, about how we can put together something that is proportionate and reasonable, and which helps us all to hold one another to account for what we want to deliver together on this. The other area where I'm going to need some further advice was touched on earlier on, and that's around housing and homelessness, which is something where a number of different partners in the room share some responsibilities, but no partner holds all of the duties themselves. But it is something which I think we need to do some further work on as a system in Nottinghamshire, and how we reflect that or not in this strategy, again, is going to need your advice and input over the coming weeks. Thank you.
Thank you, Jonathan. A framework for evaluating outcomes of interventions exists in the Public Health Outcome Framework, which we report to the Health and Wellbeing Board every quarter, which is still a good, valid indicator. And of course, we've moved to population health management statistics, and statistics are clearly going to be the driving force towards reducing health inequalities as we go forward. Melanie Brooks.
Yeah, so a similar point to Jonathan. So the health and wellbeing strategy is quite crucial at this time. So it's the key vehicle for which we communicate the needs of our population to our partners. So it should drive the budget setting process within the county council. It will certainly drive the emerging integrated care strategy that the reforming, or I suppose remaking, whatever we want to call it, in the integrated care system, that process of NHS restructuring that's currently taking place. The end product for there will be a strategy for Nottinghamshire and Nottingham City to inform NHS commissioning. So this work is quite crucial. So I think one of the challenges that Jonathan hasn't mentioned is how we're going to pull together a sort of a needs assessment with partners at the time we're still responding to COVID, and to understand the impact of COVID on the needs of our population. So there's going to have to be a sense of agility, I think, with this strategy that we probably haven't had in previous years. So I think that engagement piece is going to be really important, and I think we're going to need to have a good support from board members in helping us achieve that.
Thank you, Melanie. I think a common theme there, we've heard it from Caroline about the interventions she knows she'd like to do, and getting the money and the support and the partnership working to introduce it. The ICS will, of course, change how we influence the way the care is produced, and at some stage we'll have to update everybody on the progress of the integrated care service. The name changes all the time: ICP, Integrated Care Partnership, and ICB, Integrated Care Board. Both of them come together to form what's known as the ICS, and it will go live in April 2022. But I think it's something that we should bring back time and time again to update everybody on progress on, and it'll be a challenge for the Health and Wellbeing Board to be the influencer through the joint strategic needs assessment of the direction of travel of the healthcare that we provide for the people of Nottinghamshire. Anybody got anything for Caroline?
Thank you very much, Chair. And again, following Jonathan's example, it's asking for advice, really. I'm really keen to ensure that the health and wellbeing and the police and crime plans that aligned in the shared areas. I'm particularly thinking about, alcohol and drugs misuse, domestic violence, mental health. it's just aligning them. So we want to deliver and work together.
Thank you very much. Councillor Martin.
Thank you, Chair. I think the biggest thing that we could benefit from is the cohesive joint strategic needs assessment or strategy. Is the educational policy is the same across all from the NHS to the ICS to the Police Crime Commissioner. The educational policy that we put out to not just children but to adults as well, because that's one thing that lacks. You get some stuff from the NHS, some stuff from there, and there's no real common directive, and I think that would make the messages coming out from all of these assessments more direct and more effective.
Sorry, just expand on educational policy. What are you saying there, Councillor Martin?
You know, we're talking about drugs abuse and all sorts of other ASB issues,
health-related messages,
health-related issues
in education.
Yeah,
just to have a uniform ability to deliver them in a consistent way to the population.
Yeah.
Okay.
And if I can just add,
not you, Caroline.
Not me.
Councillor Barney, come in. You haven't spoken yet. You have not spoken yet, Councillor Barney.
I know I've been sitting here very quietly, and I thought I'd better speak up and declare a slight interest. It's not really an interest, but it's a joy to be here this afternoon as a substitute, because with another hat on and in this chamber, I sit on the Health Scrutiny Committee chaired by Sue Saddington. And as a spy in the camp today, it's been quite interesting, actually, just to feel the synergies that there are between the two groups and the two committees. And I have to say that from where I'm sitting, and not speaking on behalf of the entire Health and Scrutiny Committee today, the work that you're doing, this joined up collaborative approach, would be very, very much welcomed by us. It's also great to meet colleagues from across the Health Board in different areas of interests across Nottinghamshire. Great to see you this afternoon. Jeremy mentioned the analogy of a tsunami already, and I know that in the Health Scrutiny Committee, we feel that the tsunami really probably hasn't hit us yet fully in terms of what COVID will bring, particularly with the fallout of mental health, as Sarah picked up on. So just really to speak up and say, thank you for having me. I'm sorry that I'm spying, and whatever you decide here, of course, will be scrutinised by Health Scrutiny at a later date. Thank you, Chair.
You're certainly welcome back anytime you like, Councillor Barney, even as a guest, just to sit and watch.
So kind. Thank you.
Dr. Griffiths.
Thank you, Jonathan. I mean, I look at our health and wellbeing strategy for 18 to 22, and we could publish this again. And the ambitions, our legal duties, our ambitions would probably be not that different. So the question for me is, how do we understand how effective this was without, as you say, creating an industry, and actually how can we absorb what's happened as a result of the pandemic to actually create a more effective method of delivering our ambitions for the next 4 years. So that for me, it's more for me about strategy. For me is the what and the why. How we deliver it, how are we going to make it more effective that we deliver the what and the why more effectively than this will do. That's for me is the challenge, and some of that will be about how we work more effectively with our partners. Some of that will be about how we improve education. Some of that will be about how we align strategies with other bodies as well. How do we make partners more accountable for the delivery of what they're actually going to say they're going to do? So that would be my thinking.
Thank you, Dr. Griffiths. And equally well, we may be intervening in a steadily increasing line of ill health, so that the slope of that index is actually being reduced, but it's still seeing in a negative sense because it's increasing, which is what Councillor Barney was alluding to, that we may only be at the beginning of a lot of the ill health which is coming around. There was a slope index in that. Jeremy, if you would mind passing it through to me. So on the last page, there is something known as the SLL, which is the slope index. And I'm going to ask Jonathan Gribben to further elucidate on that.
I can have a shot at that. So I think what you're referring to is a chart which set out how life expectancy varies across different communities in Nottinghamshire. And that particular chart set out for us how it changes if you were to arrange communities in terms of how advantaged they are, with starting off with the most disadvantaged and working up to the most advantaged. You'd actually see that in Nottinghamshire, with the data that we have at the moment, in life expectancy for females, there's a difference of just something over 14 years between the least and most advantaged communities. Chair, you touched on this a moment or two ago when you were talking about something, not life expectancy, but healthy life expectancy. And that's really important as well, because actually, if we were to, with the most recent data that I recall from just before the pandemic, if we were to walk down the road into West Bridgeford, and if it were possible to find such a person as the average woman in Rushcliffe, we'd find that she was enjoying healthy life right the way through to the age of about 70 on average for a woman in Rushcliffe. If we were to go up to Mansfield, for example, and to walk into Mansfield town centre and to find this kind of hypothetical average woman in Mansfield, we discovered that she had lost health, or good health, I should say, about 12 years earlier. So well before retirement age, at a point in time where she and her peers might be expected still to be at work in the economy. And that, I think, underlines for us just that some of the enormous differences that we're still grappling with. It comes back to your point, Jeremy, that actually this time around we probably need to sharpen our ambition and to think differently about how we deliver some of this. And I think it also underlines how we need to be thinking about economy and health, not as two things that are on opposite poles where we make a choice between them, but actually two things that we have to address together. To have a really flourishing economy, we have to also make sure that we've got a healthy population and vice versa. So that was a rather longer answer than you banked on, John. But
yes, but nonetheless very elucidating. I think if you look at Rushcliffe again and you go up to Mansfield and you see that they'll live 7 years longer in Rushcliffe, which is where Jeremy's from, and live 7 years less in Mansfield, 50% of that is entirely down to smoking. 15% of it is down to nutrition. So the health inequalities, the loss of life expectancy, the loss of healthy life expectancy is one of life's great mysteries. Is actually quite simple, but addressing health inequalities is the difficult challenge. And that's what we would like to do in the next 4 years, to address the inequalities. We know what they are, we know what leads to them. They're not mysterious. We could reduce that overnight by stopping smoking to 3.5 years from 7 years, and by healthy diet even further. So that's our challenge, and that's what we're going to look to try and intervene in. Caroline.
Thank you very much, Chair. It is a challenge, but one of the things I think we could look at is some joint communications. I'm particularly thinking about drugs, which is such a scourge on our society. And I don't think there's enough communications about how those drugs get into our county, what those drugs contain. I think there could be some joined up communications there, which would absolutely put people off taking them.
Dr. Griffiths.
And I think the really crucial thing is not one size fits all. It's not a leaflet through a door. We have to communicate to individuals in the method that is going to be the most effective for them to get that message. And I'm not quite sure that that's got through across all partners at the moment.
if you're thinking about other students who'll be coming back very shortly, starting at the units, and yes, we're going to have a police presence going down to Freshers Week and doing the education stuff. But we know they're looking on Instagram, so we need to be doing some compelling videos on Instagram, so they don't think it's an acceptable thing to do.
Thank you, Caroline. The next outing will be a workshop on the Health and Wellbeing Board strategy, and I'm hoping that you'll all be present to feed into that. I'm going to move that the Health and Wellbeing Board approve the proposed approach to refresh of Nottinghamshire Joint Health and Wellbeing Strategy 2022 to 2026 and consider whether there's any action they required in relation to the issues, and agree to receive a Health and Wellbeing Board workshop on Health and Wellbeing Strategy on Wednesday the 13th of October. Move the motion. Seconded? Yes. All those in favour? Carried. So we're going to move on now.
Thank you, Chair.
Oh, thank you, Sue. So we're going to move on to item number 8, which is the Joint Commissioning or Integrated Care and Better Care Fund update from Cash Ahmed on Teams, page 41. Over to you, Cash.
Thank you, Chair. Good afternoon, everybody. Okay, I'll just provide a quick overview. It's a short paper. The paper aims to update Health and Wellbeing Board on the approach to joint commissioning. We've so far settled on the term joint commissioning. There's been lots of debate whether we call it integrated commissioning, joint commissioning, but there's more discussion. But for the purpose of for now, we're sticking to joint commissioning for and it's providing an update in terms of our approach and a process to develop our approach to integrated commissioning or joint commissioning within Nottingham and Nottinghamshire integrated care system. Just in terms of a bit of background context, is there's an overall recognition across the system and even nationally that in order to achieve desired outcomes, improve population outcomes, improve quality of services, and also reduce health inequalities, as commissioners, we need to be commissioning in a more joint and joined up in a more joint integrated commissioning approach. We need to operate and work in a different way where there's much more collaboration and joint working across commissioning bodies, across health and social care, and also even broader in the sense of housing, police and other commissioners in the system. As part of this work, what we've done is we've established a working group that will help us to shape some of this work going forward, and also just to make the point that Bassetlaw CCG are also part of this work, and again the recent announcement does around ICS boundaries does significantly help matters and support this work going forward from a Bassetlaw perspective. Just also in terms of Nottingham City Council, the County Council and the CCG, what we are wanting, it's really ambitious, we are wanting to work towards a single strategic approach to commissioning and integrated services for the population of Nottingham and Nottinghamshire, and across all ages, with ICPs, integrated care partnerships, responsible for integrated provision at a place level. We also want to build on the really good work from the Children's Integrated Commissioning Hub, which is responsible for commissioning a range of universal and specialist services for children and young people on behalf of the NHS and local authority. In addition to this, we also want to build on the really good work that's been happening across during the pandemic between all partners. It's clear to see that the partnership and joint working has gone to another level during the pandemic, and we want to build on that success. And there's a really good appetite to progress joint working as business as usual. What I want to also just highlight is that in July's Health and Wellbeing Board meeting, there was discussion and an agreement to establish a integrated board or a commissioning board. what the paper states is that before we do that, what we've said is that we need to do some more groundwork, more scoping and groundwork before we start this journey. And the grounding work that we need to do, it's actually based on 3 strands of area of work. Firstly, what we need to do is, as a system, is to agree a framework, a joint commissioning framework that sets out clear principles and behaviours and outcomes, and sets those out. And I think we want to co-produce that with partners. So that's one piece of work that will help us to clearly set out a joint commissioning framework with those principles that are needed in order to progress this work. Second strand of work will be around the governance for integration of health and care commissioning. Recognise the governance is complex, but what we need is clear lines of accountability and how decision and risk taking and risk sharing are taken. And again, we want to ensure that there is a shared agreement between partners around the governance arrangements that we want to develop going forward. And finally, the third strand of work is actually a programme of work, a really ambitious programme of work around joint commissioning across all sectors of commissioning, whether it's public health, adult social care, health, housing, and so on and so forth. What we want to do is have a programme of work that there are clear areas of work that where we want to go further and faster around joint commissioning. In order to progress this work, we have asked local LGA, Local Government Association, and ICP, the Institute of Public Care, to help us with this approach. So LGA and ICP will run a series of workshops around the development of a framework and the principles, help us to articulate our ambitions, also help us to shape the governance and agree a governance arrangements, and then also help us to agree a programme of work. So there will be a series of workshops during September and October to help us with some of that groundwork, some of that development work, and we will then come back with an update on progress following those workshops back to the board for further discussion and approval. So that's in a very quick summary of the paper in terms of our approach and process that we've set out around joint commissioning. Happy to take any further questions.
It's surely to be one of the greatest challenges going forward, joint commissioning. So I'm going to throw it out there and see if anybody has got any questions. Or Councillor Tidwell.
Well, I'm going to have to make this short because I'm really struggling this afternoon again because of hearing problems. Collie, sorry, where you are, it's very echoey actually, so I wasn't able to understand a lot of what you're saying. And at 4:30, I've got to go and pick up 5 food parcels to take out to the community, right, as well as everybody else is. And there's a lot of things that I have missed from earlier, which I need to get through anyway. They talk about strategies for, oh Christ, where are we?
Police and crime.
With the drugs, Caroline, please. I come from Chilwell West and we've got big problems. We've had big problems for a long time. And I know that the supply chain to the stores have been interrupted, but the interruption to the supply chain in Chilwell West is not. It's absolutely abominable. It needs sorting. Please. There's a lot of families that are suffering because of it. And also families that aren't taking it, they're suffering as well because of the aggression that's going out. Don't want to say any more because we are actually going live. So please get them to sort the problem out.
Did you want to comment, Councillor Tidwell, on the other plans?
The thing
joint,
with
joint health and wellbeing.
Yep. I'm absolutely. When I was in nursing, autism was actually classed as schizophrenia. Yeah.
Yes.
part of the schizophrenia. And what I want to know is the Children's Learning Centre going to be involved in this, because they are at the forefront. I'm a big advocate of what used to be Sure Start. And I know they've got so much input to put in, especially the local community around us. We've got autistic people, and I want to see them getting a good package, as well as all youngsters. Unfortunately, we know that the budget has been reduced time and time again with them. We talk about integration. It's a lot of hard work working with people who where I have to take food out to, and getting the message over to them. I listened to a difficult scenario today, that they are permanently living in a difficult scenario, understanding why you're trying to help them and understanding their well-being. And unfortunately, I'm going to have to call it today, because I've got to go out and actually do some food delivery. So thank you for listening to me.
Thank you, Councillor Tideswell. I think that the integrated care service provides us with the single greatest opportunity in the last number of years to take things which ran in parallel and make them run like a circle. We've always had county council work, we've always had NHS work, we've always had voluntary work, and the whole ethos around the pooling of a budget is to stop duplication and to increase the opportunities of co-production and working together. It's a single fantastic opportunity for the people of Nottinghamshire going forward, and I'm mightily optimistic for it. I think hopefully we'll be able to show you the fruits of that as the years go past. Any other comments? Councillor Martin.
Yeah, thank you, Chair. Looking at the on page 51, the network that's being established, you know, some of the partners that are being established in that network there could actually have a massive impact on the reduction of suicide if their departments were actually more educated about the impact of what they're actually doing to the people who communicate with them. So I'll give you a typical example. I've got a resident of mine who's been in a, just bear with me, been in a marriage for 5 or 6 years.
Councillor Martin, can I just check what item of the agenda that you're on?
Yes,
you mentioned mental health and one thing and another, and that's our next item agenda on page 9.
Are we still on item 8?
Yes.
Yeah.
So we'll come back to you if that's.
Oh, sorry. Yeah, sorry, I'm ahead of one.
You're ahead of us. Fantastic. Any further questions for Cash, who's got a monumental job ahead of him with integration? Dr. Griffiths.
Thank you, Cash. Just wanted to know how we as the Health and Wellbeing Board will be updated on the work of this group going forward.
Thank you. So the proposal is to bring regular updates to the board, and so I think the next stage will be the outputs, to report on outputs and the outcomes from the workshops that will be conducted by LGA and ICP. So we're looking to have something more tangible to present to the board later this year. And I can work with Bryony on scheduling that with the board forward plan.
Thank you.
Thank you, Cash. In terms of the recommendations, we're going to consider whether or not there are any actions in relationship to the report for joint commissioning for integrated care for Nottingham and Nottinghamshire Integrated Care Service. Consider the role of the Health and Wellbeing Board in delivering joint commissioning for integrated care, including the recommendation that the previously proposed Nottinghamshire Integration Board is not established at this particular time. I move the recommendations. All those in favour? Thank you very much, Cash. We'll move on. Thank you. We'll move on now to item number 9, which is an approach to mental health, which Councillor Martin is ahead of us on here. I'll just pass over to you, Councillor Martin. An approach to mental health. Many of you were present when we had a wonderful workshop on mental health, all age group mental health in the County Hall. The paper itself looked at a number of areas of intervention, particularly the reinvigoration of what was called the mental health Concordat, which is simply an agreement which was first started in 2019, and then we sort of refreshed it where organisations agree to sign up for a year to find a mental health champion, to find a mental health first aider, and to recognise the mental health of their workforce, and not just the mental health but the mental well-being and how important that is for companies and organisations, etc. I'm going to pass over to Kath Pritchett. Kath, are you with us?
Yes, can you hear me, Councillor Doddy?
Can hear you loud and clear. Do you want to carry on?
I will. Thank you very much, and thank you for that introduction. So as Councillor Doddy mentioned, this report is the follow-on for the very successful discussion that we had at the end of July this year, and really is thinking about a way forward. It links very well to the conversations that have already taken place on the board, in that it will link to the health and wellbeing strategy going forward, to the council plan that Derek Higton spoke about, and also some of the work that the Police and Crime Commissioner mentioned about the importance of joint communications. So just as an overview, colleagues will be aware about the massive impact that mental health has on our communities and our need to make sure that we promote positive mental health. And I include in that the issue about suicide and suicide prevention. We spoke at length at the workshop meeting on the impacts of COVID and the impacts that they had on mental health on our communities in Nottingham. And you will see that we've tried to demonstrate both the positive and negative impacts that colleagues expressed to us during the workshop. So we went on from that work and from hearing the issues that you raised, and we felt as though there were three key theme areas. Communities came out very strongly, both the strengths and asset of communities and supporting communities going forward. Children and young people and ensuring resilience of children and young people was also a theme that came forward. And the final themes were around both our own workforce and leadership within the workforce to ensure that mental health promotion is considered a priority. So within that, we identified a certain set of actions. The first one, and again, this links to Caroline Henry's comment about supporting a consistent approach to mental health promotion messages and communications campaign. And we're working across our suicide prevention strategy group and across the Health and Wellbeing Board to try and ensure that our communications are consistent. And to this end, we're working to provide consistent messaging for the World Suicide Prevention Day, which takes place on the 10th of September. So we'll share resources and hopefully get a wide variety of people sharing those resources. Action 2 was to commit to further improving the knowledge, competencies and skills of the workforce in relation to mental health promotion and suicide prevention. And this was particularly around increasing the number of people that are trained in mental health awareness, for example, mental health first aid or its equivalent, and suicide awareness and training. And we're utilising some money that we've had that we call Wave 4 funding to understand what's happening in relation to training across the system. And we would ask and encourage members of the board to support that review that's taking place. And action 3 was to sign up to further help us develop a place-based approach to mental health. And I'm pleased to say that a number of colleagues from districts and boroughs have already approached Public Health England to sign up to the Prevention Concordat to demonstrate their commitment. And finally, we spoke about mental health being a key priority for the joint health and wellbeing strategy. So linking to the presentation that Sue's just provided, where we were recommending that we adopt a vision to make Nottinghamshire County where everybody's supported to achieve good mental health throughout their lives, with delivery focused on the most vulnerable via a place-based approach to mental health promotion. So that's a brief overview of the paper, Councillor Doddy, but obviously very happy to take questions and comments from the group.
Thank you, Kath. I'm going to finish that off by saying that we came up with a proposed vision to make Nottinghamshire a county where everybody is supported to achieve good mental health throughout their lives, with delivery focused on the most vulnerable via a place-based approach to mental health promotion. And that was the vision. It is interesting about the Concordat, because as I sit here with Jeremy, I'm thinking that we both sit on primary care networks, and there are 20 primary care networks representing 1.2 million people across the ICS, and that would be a wonderful place to get all of them to sign up to the mental health Concordat. So I think that's something that we perhaps could work on, Jeremy.
I think signing up to anything is fine as long as it's followed up by action.
Any communications to Kath with regards to the mental health workshop, or any feedback from anybody who was present at it? Mental health being a huge part of our strategy going forward. We've got probably 1 in 10 of all children developing mental health problems throughout their life. 170,000 children in Nottingham, 17,000 children with mental health problems. Councillor Wheeler.
Yeah, as a professional that works with young people, obviously one of the schools that I work at, because I've been waiting for quite some time to see some action around mental health, they've actually recruited their own counsellor recently this term. We've also got a lead now for mental health within the school, which is a Senko, and then we've got a learning support assistant who is leading on mental health more as well. And then there's we're now accessing the some of the other services around mental health as well within school, but we've not had the funding as yet coming through to us. So I'd be interested to see what funding has been delivered, or what work has been done with schools across the county in terms of tackling some of those really big issues, because obviously over the last 12 to 18 months there's been huge trauma amongst a lot of our young people. I mean, the pandemic has proved really problematic for a lot of young people in terms of broken networks, social networks, and so forth. For some young people, it's been positive, but that's been a minority. When I'm talking about positive, I'm talking about young people who have been school phobic in the past and didn't really like to attend school for various reasons. For some of those, that their health has actually improved, but for the vast majority of young people, because of the social networks that they used to have, because of the consistently having to isolate, not just once, twice, but 3, sometimes 4 times within less than 3 months, it's caused a huge amount of trauma to young people. Across the county, but also when you're talking about trauma, I think the whole COVID experience has been a trauma for everybody. Quite frankly, I think everybody in some way has been traumatised in one way or another by the COVID pandemic, whether that's because of the issues around some of the news headlines and so forth, or whether it's because of the social networks breaking down, because of isolating, because of issues around work. Not being able to go to work or having to work remotely, and all sorts of other different reasons. I think there needs to be a huge focus on tackling mental health and wellbeing issues across the whole population, demographically speaking, because it's impacted on just about everybody, I should imagine, in some way or another. Finally, can I just ask, did you actually receive my apologies for the workshop on the workshop that happened, because I was unable to attend due to work commitments? Thank you.
If not, I belatedly accept them now.
Thank you.
Thanks, Councillor Wheeler. Yes, I mean, I do think you talk a lot about the children, and Colin is in charge of the corporate director for children and young people. CAMS is one of the areas where we've had remarkable success. Targets from the government were set at something like 35%, and we're over 50%. Huge amount of first assessments for children. We put an extra £1 million into the service, delivering an extra 70,000 first contacts every year for the next 3 years. I would say that the performance of CAMS in Nottinghamshire is far in excess of anywhere else in the country. Equally wise with regards to mental health and mental health provision. The eating disorder service is one of the finest services that I've ever used. The amount of people seen within 1 week of presenting with eating disorders is phenomenal, and everybody is seen within 4 weeks. And as a team working within CAMS eating disorders team, it's quite exceptional. So mental health services in Nottinghamshire are doing exceptionally well and set to get even better over the next 3 years with the increased face-to-face 70,000 appointments for CAMS, the increased investments, and building on the success of eating disorders, and I'm mightily impressed by it. Colin.
Thank you, Chair. And the next agenda item is the forward plan. And I note from the forward plan the meeting after next, which is Wednesday, 24th of November. Yeah, on the agenda is the local transformation plan for children and young people's mental health. Yeah, and I would suggest, with your agreement, Chair, that part of that report covers the Wellbeing for Education, Return and Recovery, and the work that's been led by Dr. Olaf Green, yeah, and the Education Psychology Service, together with colleagues from Public Health and the NHS. And we can probably, at that point, I hope, yeah, I'm looking towards Catherine, yeah, on the screen, yeah, also perhaps mention the launch of the Not Alone, yeah, website, and why we've come to offer the digital option, yeah, for what children and young people were asking.
Yeah, fantastic. I think that's going to add significantly to the importance of that item. Dr. Griffiths.
Yeah, it's just following on from what you say there, Colin. I think it would be really interesting if it's possibly we could learn from the Bassett Law approach and some of the transition services from children to adult as well. Maybe drawing that into that particular area. So I'm sure mental health transition is an area which really needs a lot of focus, I would say, and it would be nice to make sure that was addressed in that.
And I would agree with you, Jeremy. I think there is lots to learn, yeah, from the all-age approach of the Bassett Law approach to the ICS for Nottinghamshire.
Thank you, Colin. Councillor Martin.
I'm on the right agenda item there.
We can only hope.
Yeah, I'm just glad to see the network being established in recognition that everyone has a role to play in suicide, because a lot of these organisations actually exacerbate the issue, especially the Department of Work and Pensions. You know, because when people get into that relationship crash and they end up splitting up and doing all that, they're dealing with the benefit system, and they're dealing with the district councils about council tax and housing issues and stuff like that. I'm wondering if we can have some kind of red flag system where those organisations across this Concord Act may all be aware, like the police and even HM prisons, you know, because when people get put on remand, and then it's all part of the same problem, because they get into that hurly-burl and they can't solve it, and the doctors can't solve it because they're only in there 5 minutes, and it's all part of the same problem. And the largest group of suicides are males between 24 and 54, you know, and they are all the same. They are all the people that go into that category. I've just got just give you a brief example. I've got one of my residents who split up from his partner 18 months ago because she had a third child with another person, and he didn't find out. and he's still being charged the parental responsibility for that. That's the Department of Work and Pensions, and he emails me every 6 weeks to say they still haven't sorted it, and that's 18 months. He's still paying all the parental responsibilities for the third person. His partner's moved out, taking the daughter with him, and he's still paying it all. And he's lost his job as a result of the relationship breakdown. He's paying the mortgage and everything, and that's the kind of pressure that hopefully some of these organisations might like to red flag, because if everybody knows about it, then it could help it.
Yes, it's not the thing that eventually leads to it. It's the culmination of events that go before it, to straw that breaks the camel's back, so to speak. And I think it's beholden on all of us to be aware of those things. And again, with the mental health concordat, to try and pick them up and deal with them instead of allowing them to get to that level. I'm going to say thank you very much, Catherine. And do you have anything to add to that before we move to the recommendations?
I was just going to say you're quite right about the groups that are at risk, Councillor Martin, and certainly we've done some work in the past with the Department of Work and Pensions, but I'll just make sure that they are continue to be represented on the suicide prevention strategy group going forward. So thank you for that suggestion.
Thank you. I move to the recommendations to consider and undertake the actions within the report on mental health to reduce the incidence of mental health problems across all ages in Nottinghamshire. Proposed actions include supporting a consistent approach to mental health promotion messages and communication campaigns, including suicide prevention and awareness, reducing stigma, signposting to support and services available for communities in Nottinghamshire. B, committing to further improving the knowledge, competencies and skills of the workforce in relationship to mental health promotion and suicide prevention. C, signing up to the Prevention Concordat and further develop the place-based approach to mental health promotion. And D, endorsing mental health as a key priority for the next health and wellbeing strategy. Will provide updates on progress every 6 months within the Chair's report and receive a report to undertake the Suicide Prevention Steering Group in the autumn. Move the motion. Have we got a seconder? Yes. All those in favour? Carried. We're going to move swiftly, as we've just passed 4 o'clock, to the work programme. The work programme is on page 61 to 66. We've already heard from Colin of the one of the items coming up, and we've got a meeting which is on the 13th of October, the workshop, which are always very interactive on joint health and wellbeing strategy. And I would encourage as many as possible to come along. And then on the 24th, we got the update on suicide prevention, children and young people's mental health, domestic abuse, etc., and pharmaceutical needs assessment. Another one for the Police and Crime Commissioner there to attend, particularly around the domestic abuse, etc. Councillor Walters.
Thank you, Chairman. Just a quick question about the workshop. Will it also be offered virtually, or do we have to come here?
We may end up with a hybrid, depending on the amount of room that's available, depending on how we decide to do the workshop. We may do it as an isolated workshop, but if an important joint strategic needs assessment came to our attention, we might start it off with a formal meeting and introduce the findings of that and then go on to the workshop. So we may do it as a hybrid in order to have the most participation possible. Bryony.
Yep, just to echo what Councillor Doddy said, there may be a virtual offer, but I'll be circulating the details about the workshop, including an agenda and any background papers in advance, so you'll be well briefed and can make the decision whether you're able to attend in person. I imagine possibly in the Rufford Suite, but obviously still to be organised, or if you'd rather attend over Teams, we can try our best to facilitate that.
Just behind you, Bryony.
Yeah, it's just a point of reference really in terms of how we conduct these meetings and workshops. ensuring that we've got access for all and that they're inclusive. I think we've demonstrated today there's some real issues for people who may be hard of hearing with the different way it's set up, and maybe from going forward, we can make sure that we can try and support individuals who might need additional support around access to any of the approaches that we do, whether that's online or in person. Because I think it's really important that we set the tone within our own board around health and wellbeing, that we're inclusive and that we provide an equal playing field for everybody to engage. So I just wanted to make that point in terms of however we go about, if we can do some pre-work to make sure that whatever people's needs are, they can be met in the meetings. I think it's very uncomfortable when you feel somebody's missed out because of potentially not being able to actively participate down to an access issue. So just wanted to make that point.
Fantastic. Councillor Walters.
Yeah, sorry, you just preempted me on that one. I noticed on this wonderful headset here, you can get earphones on this. Would that not help solve that problem?
Depends what's on the earphones.
You know, I mean, I've just seen, is it possible if you plug in an earphone here, you've got it looks like you got a volume control. Would that not? Who's the expert on that IT?
I have no idea. We'll go over to Martin.
I'll find out, Chair. The Chamber does have a hearing loop, and I have advised Councillor Tideswell of that previously, but he was obviously in some difficulties today, so we'll address it with him outside the meeting.
Okay, but we have a hearing loop and it was in action and he was aware of it.
As far as I know, I'll double check. I'm sure it's in operation.
Okay. Fantastic. It's just gone. Oh, yes, Councillor Walters. That's it. You're right. That is it. We've thank you all for your physical and mental resilience in making it to the end of the meeting at just after 4 o'clock. I think it's been fantastic and I welcome you all to the workshop. Thank you.